Question 1. A nurse is caring for a client newly diagnosed with chronic obstructive pulmonary disease, COPD. The client asks, "What's the most important thing I can do to manage this disease?" A. Increase fluid intake to at least 3 liters per day. B. Perform pursed lip breathing exercises daily. C. Avoid exposure to tobacco smoke. D. Get an annual influenza vaccination. Answer: C. Avoid exposure to tobacco smoke. This question tests understanding of the primary risk factor and most crucial intervention for managing COPD. The keyword "most important" highlights the need to identify the foundational action. Avoiding exposure to tobacco smoke, including secondhand smoke, is the single most significant factor in preventing the progression of COPD, as smoking is the leading cause of the disease. While other options like pursed lip breathing, fluids, and vaccinations are important management strategies, ceasing exposure to the primary irritant offers the greatest impact on long-term disease trajectory. For example, if a client continues to smoke, other interventions will have limited effectiveness. Here's an easy way to remember: eliminating the cause is always the most important step in managing a chronic, progressive disease like COPD. Question 2. A client is admitted with heart failure and has a 24-hour urine output of 800 milliliters. The nurse notes crackles in the client's lungs and 2+ pitting edema in the ankles. Which medication is the nurse most likely to administer? A. Lisinopril. B. Furosemide. C. Metoprolol. D. Digoxin. Answer: B. Furosemide. This question assesses knowledge of medication management for fluid overload in heart failure, indicated by the symptoms and low urine output. The keywords crackles, pitting edema, and heart failure point directly to fluid volume excess. Furosemide is a potent loop diuretic used to remove excess fluid from the body, thereby reducing symptoms like pulmonary congestion, crackles, and peripheral edema. For instance, by increasing urine output, furosemide helps decrease the workload on the heart and alleviate respiratory distress. Remember, when a client with heart failure shows signs of fluid overload, a diuretic is often the immediate priority. Question 3. A client with a new colostomy expresses concern about odor. What is the most appropriate nursing instruction? A. Avoid eating gas-producing foods. B. Use an ostomy deodorant in the pouch. C. Change the pouch every day. D. Empty the pouch when it is half full. Answer: B. Use an ostomy deodorant in the pouch. This question addresses a common concern for clients with colostomies and tests practical management strategies. The keyword odor directly indicates the problem to be solved. An ostomy deodorant can be placed directly into the pouch and is effective in neutralizing odors, providing immediate relief and improving the client's quality of life and confidence. While avoiding gas-producing foods can help, and emptying when half full prevents leakage, a deodorant specifically addresses the existing odor. For example, some deodorants come as drops or gels that can be easily added to the pouch. Remember to offer practical solutions for common client concerns like odor and gas. Question 4. A nurse is preparing to administer a blood transfusion. Which action is the priority for the nurse to take before initiating the transfusion? A. Obtain the client's baseline vital signs. B. Ensure the client has an 18-gauge 4 catheter. C. Verify the client's identity and blood product with another licensed nurse. D. Educate the client about potential transfusion reactions. Answer: C. Verify the client's identity and blood product with another licensed nurse. This question tests the critical safety steps involved in blood product administration, with priority indicating the most crucial action. Verifying the client's identity and the blood product with another licensed nurse is a mandatory, life-saving step to prevent fatal transfusion reactions due to misidentification or mismatched blood. While other steps like vital signs, for gauge, and education are important, ensuring the correct client receives the correct blood is paramount before starting the infusion. For example, mislabeling or administering to the wrong client can cause acute hemolytic reactions. Always remember, a double check by 2 nurses is the gold standard for blood transfusion safety. Question 5. A client with type 1 diabetes mellitus is found unconscious. The client's blood glucose level is 45 mg per deciliter. What is the nurse's immediate action? A. Administer 4 ounces of orange juice. B. Administer 1 mg glucagon intramuscularly. C. Provide a complex carbohydrate snack. D. Obtain a STAT comprehensive metabolic panel. Answer: B. Administer 1 mg glucagon intramuscularly. This question focuses on the immediate management of severe hypoglycemia in an unconscious client with type 1 diabetes. The keywords unconscious and blood glucose level is 45 mg per deciliter, which is critically low, indicate a severe hypoglycemic emergency. Since the client is unconscious and cannot safely swallow, administering glucagon intramuscularly is the appropriate and fastest method to raise blood glucose by stimulating the liver to release stored glucose. Giving orange juice or a snack would be dangerous due to the risk of aspiration, and a lab panel is not the immediate priority over treating the life-threatening low sugar. For instance, glucagon acts quickly to restore consciousness so the client can then safely consume oral carbohydrates. Always prioritize immediate life-saving interventions for an unconscious client with severe hypoglycemia. Question 6. A client undergoing chemotherapy reports severe nausea and vomiting. Which nursing intervention is most appropriate to help manage these symptoms? A. Offer large meals 3 times a day. B. Administer antiemetic medication as prescribed before meals. C. Provide strong-smelling foods to stimulate appetite. D. Encourage consumption of hot, spicy foods. Answer: B. Administer antiemetic medication as prescribed before meals. This question assesses the nurse's understanding of managing chemotherapy-induced nausea and vomiting, CINV, a common and distressing side effect. The keywords severe nausea and vomiting directly point to the problem needing intervention. Administering antiemetic medication as prescribed, especially before meals or chemotherapy sessions, is the most effective way to prevent or control CINV, making it easier for the client to tolerate food and maintain nutrition. Offering large meals, strong-smelling foods, or spicy foods would likely exacerbate the symptoms. For example, giving ondansetron 30 minutes before a meal can significantly reduce nausea. Remember to be proactive with antiemetics to prevent distress rather than just reacting to it. Question 7. A client with deep vein thrombosis, DVT, is prescribed warfarin. Which food should the nurse instruct the client to consume consistently and in moderation? A. Spinach. B. Beef. C. Bananas. D. White bread. Answer: A. Spinach. This question tests the nurse's knowledge of dietary considerations for clients taking warfarin, specifically regarding vitamin K intake. Warfarin works by interfering with vitamin K-dependent clotting factors, so spinach is a key food because it is high in vitamin K. The instruction is to consume vitamin K-rich foods consistently and in moderation, not to avoid them entirely, as fluctuations in intake can affect the medication's effectiveness, INR levels. For instance, drastically changing spinach consumption could make the blood too thin or too thick. The goal is consistency in diet to allow for stable dosing of warfarin. Here's an easy way to remember: foods high in vitamin K can affect warfarin, so consistency is key. Question 8. A nurse is assessing a client with a suspected stroke. Which finding requires the most immediate attention? A. Facial droop. B. Sudden severe headache. C. Unilateral weakness. D. Slurred speech. Answer: B. Sudden severe headache. This question asks for the most critical symptom of a suspected stroke, requiring immediate attention. While all listed symptoms are indicative of a stroke, acting as keywords for stroke assessment, sudden severe headache, especially described as the worst headache of my life, can be a hallmark sign of a hemorrhagic stroke, which often carries a higher mortality rate and requires rapid intervention. Prompt identification of a hemorrhagic stroke versus an ischemic stroke dictates different treatment pathways, such as not administering thrombolytics in a hemorrhagic stroke. For example, a CT scan is urgently needed to differentiate stroke types. Remember, a sudden, severe headache is a red flag for a potentially more life-threatening hemorrhagic stroke. Question 9. A client is receiving total parenteral nutrition, TPN. The nurse notes the TPN solution bag is empty and the next bag is not yet available. What is the nurse's priority action? A. Flush the 4-line with normal saline. B. Hang a bag of 10% dextrose in water, D10W. C. Administer an insulin injection. D. Discontinue the 4-axis and restart when TPN is available. Answer: B. Hang a bag of 10% dextrose in water, D10W. This question tests the nurse's understanding of TPN management and preventing hypoglycemia if TPN is abruptly stopped. The keywords TPN solution bag is empty and the next bag is not yet available indicate an interruption in the continuous glucose supply. TPN solutions contain high concentrations of dextrose, and suddenly stopping them can cause rebound hypoglycemia due to the body's continued high insulin production. Hanging D10W at the TPN rate provides a temporary source of glucose, preventing this dangerous drop in blood sugar. For example, a client who abruptly stops TPN without a substitute might experience tremors, confusion, and diaphoresis. Always ensure a dextrose-containing solution is available as a temporary measure if TPN is unexpectedly interrupted. Question 10. A nurse is caring for a client post-thyroidectomy. Which assessment finding is the most critical to report immediately to the healthcare provider? A. Hoarseness and a sore throat. B. Client complains of numbness and tingling around the mouth. C. Slight incision site redness. D. Client states feeling tired. Answer: B. Client complains of numbness and tingling around the mouth. This question evaluates the nurse's ability to identify a critical complication after a thyroidectomy. The procedure puts the parathyroid glands at risk, and numbness and tingling around the mouth are classic signs of hypocalcemia, often due to accidental removal or damage to these glands. Hypocalcemia can lead to serious complications like tetany, laryngospasm, and seizures, making it a medical emergency requiring immediate attention. While hoarseness and fatigue are common post-op, and slight redness might be normal, signs of hypocalcemia are a top priority. For instance, you might also look for Chvostek's or Trousseau's signs. Always remember that signs of hypocalcemia post-thyroidectomy are a critical emergency. Question 11. A client with a new prescription for an opioid analgesic for acute pain asks the nurse, "Will I become addicted to this medication?" What is the nurse's best response? A. Yes, you will likely develop a physical dependence, but that's different from addiction. B. Addiction is very rare when opioids are used for acute pain as prescribed. C. We will monitor you closely, but it's a concern with any opioid. D. You won't become addicted if you only take it when your pain is severe. Answer: B. addiction is very rare when opioids are used for acute pain as prescribed. This question addresses a common client concern about opioid use and requires accurate, reassuring education. The keyword addicted prompts the nurse to differentiate between physical dependence, which can occur with therapeutic use, and addiction. When opioids are used for a short duration to manage acute pain, under medical supervision and as prescribed, the risk of developing true psychological addiction is very low. This factual and reassuring statement helps alleviate the client's fears while promoting adherence to the prescribed regimen. For example, someone recovering from surgery is unlikely to become addicted by taking pain medication for a few days as needed. Here's an easy way to remember: using opioids for legitimate acute pain, as prescribed, rarely leads to addiction. Question 12. A nurse is caring for a client with pneumonia. The client's oxygen saturation is 88% on room air. What is the priority nursing intervention? A. Encourage the client to deep breathe and cough. B. Administer prescribed bronchodilators. C. Apply supplemental oxygen via nasal cannula. D. Elevate the head of the bed. Answer: C. Apply supplemental oxygen via nasal cannula. This question tests the nurse's ability to prioritize interventions for hypoxemia in a client with pneumonia. The keywords oxygen saturation is 88% on room air indicate a critical level of hypoxemia that requires immediate correction. Applying supplemental oxygen is the fastest way to improve oxygenation, directly addressing the life-threatening low saturation. While deep breathing, bronchodilators, and elevating the head of the bed are beneficial for pneumonia, they are secondary to immediately improving oxygen saturation. For instance, 88% is significantly below the target of 92% or higher for most clients. Always prioritize immediate interventions to correct life-threatening physiological parameters like hypoxemia. Question 13. A client with a new diagnosis of atrial fibrillation is being discharged on warfarin. Which instruction is most important for the nurse to include in the discharge teaching? A. Take aspirin daily to prevent blood clots. B. Report any signs of bleeding, such as nosebleeds or blood in urine, to the healthcare provider. C. Increase intake of foods rich in vitamin K. D. Schedule weekly blood pressure checks. Answer: B. Report any signs of bleeding, such as nosebleeds or blood in urine, to the healthcare provider. This question focuses on critical safety education for clients taking an anticoagulant. The keyword warfarin indicates an increased risk of bleeding. It is paramount that clients on warfarin understand and report any signs of bleeding immediately because excessive bleeding can be life-threatening and may indicate that the medication dose is too high. Aspirin should not be taken concurrently without specific instruction, and vitamin K intake should be consistent, not increased. Blood pressure checks are important but not as immediately critical as monitoring for bleeding. For example, a minor nosebleed could escalate if not reported and managed. Always prioritize teaching about potential life-threatening side effects of high-risk medications. Question 14. A nurse is assessing a client with a history of liver cirrhosis. Which finding indicates a potential complication and requires immediate attention? A. Ankle edema. B. Jaundice. C. Asterixis. D. Pruritus. Answer: C. Asterixis. This question tests the nurse's ability to recognize a serious neurological complication of liver cirrhosis. The keyword immediate attention signals the need to identify the most acute or dangerous symptom among the choices. Asterixis, also known as liver flap, is a characteristic tremor seen in clients with hepatic encephalopathy, indicating the accumulation of toxins, like ammonia, in the brain. This is a sign of worsening liver function and can lead to coma if not promptly managed. While ankle edema, jaundice, and pruritus are common with cirrhosis, asterixis suggests a more urgent and potentially life-threatening neurological deterioration. For instance, this tremor is often assessed by having the client extend their arms and wrists. Always prioritize neurological changes in clients with liver disease. Question 15. A client with hypertension is prescribed a thiazide diuretic. The nurse should instruct the client to monitor for which electrolyte imbalance? A. Hypernatremia. B. Hyperkalemia. C. Hypokalemia. D. Hypocalcemia. Answer: C. Hypokalemia. This question assesses knowledge of common side effects of thiazide diuretics. The keywords hypertension and thiazide diuretic are the clues, as these medications promote the excretion of sodium and water, but also potassium, leading to hypokalemia, low potassium. Clients taking thiazide diuretics often require potassium supplementation or an increased intake of potassium-rich foods. Monitoring for symptoms like muscle weakness or cardiac dysrhythmias is crucial. For example, a client might experience leg cramps due to low potassium. Here's an easy way to remember: K-loss is a common issue with many diuretics, especially thiazides and loop diuretics. Question 16. A nurse is teaching a client about self-management of asthma. Which statement by the client indicates a need for further teaching? A. I should use my bronchodilator inhaler when I feel short of breath. B. I will take my inhaled corticosteroid every day, even when I feel well. C. I should call my doctor if my peak flow readings are consistently in the yellow zone. D. I can stop my controller medication if I haven't had symptoms for a month. Answer: D. I can stop my controller medication if I haven't had symptoms for a month. This question evaluates the client's understanding of long-term asthma management. The keyword further teaching indicates an incorrect statement by the client. Controller medications, such as inhaled corticosteroids, are taken daily on a long-term basis to prevent inflammation and symptoms, even when the client feels well. Stopping these medications prematurely, even without symptoms, can lead to uncontrolled asthma and increased risk of exacerbations. Bronchodilators are for acute symptoms, and yellow zone peak flow readings warrant reporting, but discontinuing daily controller medication is a common and dangerous misunderstanding. For instance, abruptly stopping an inhaled corticosteroid can lead to a rebound in airway inflammation. Always emphasize that controller medications are for consistent, daily use to manage chronic conditions. Question 17. A client with a head injury develops a temperature of 103 degrees Fahrenheit 39.4 degrees Celsius and becomes restless. Which nursing intervention is the most appropriate first action? A. Administer a prescribed antipyretic medication. B. Apply a cooling blanket. C. Increase intravenous fluid rate. D. Assess for signs of infection. Answer: B. Apply a cooling blanket. This question focuses on managing hyperthermia in a neurologically compromised client. The keywords head injury, temperature of 103 degrees Fahrenheit 39.4 degrees Celsius, and restless signal a potentially neurogenic fever or increased intracranial pressure, ICP, both of which can be worsened by fever. Applying a cooling blanket is a rapid and direct physical method to lower core body temperature, which is crucial in preventing further neurological damage and reducing metabolic demands in a client with a head injury. While antipyretics and fluids are also important, direct cooling provides a more immediate reduction in temperature. For example, uncontrolled fever can increase brain metabolism and cerebral blood flow, potentially exacerbating brain injury. Prioritize immediate cooling measures for significant hyperthermia in neurological clients. Question 18. A nurse is reviewing the arterial blood gas, ABG, results for a client with severe diarrhea, pH 7.28, PaCO 235 mm of mercury, HCO3 18 milliequivalent/L. Which acid-base imbalance does this indicate? A. Respiratory acidosis. B. Respiratory alkalosis. C. Metabolic acidosis. D. Metabolic alkalosis. Answer: C. Metabolic acidosis. This question tests the nurse's ability to interpret ABG results. The keywords pH 7.28, low, indicate acidosis. PaCO 235 mm of mercury, normal, rules out a primary respiratory issue, and HCO3 18 milliequivalent/L, low, points to a metabolic problem. Severe diarrhea causes a loss of bicarbonate, leading to metabolic acidosis. The pH is low, and the bicarbonate is low, with a normal PaCO 2, confirming this interpretation. For example, the body loses base, bicarbonate, through the gut in diarrhea, leading to an acidic state. Remember, when the pH and bicarbonate are both moving in the same direction, both low for acidosis, both high for alkalosis, and the PaCO 2 is normal or compensatory, it's typically a metabolic issue. Question 19. A client is prescribed phenelzyme, Nardil, a monoamine oxidase inhibitor, MAOI. Which food should the nurse instruct the client to avoid? A. Fresh fruit. B. Whole grain bread. C. Aged cheese. D. Cooked vegetables. Answer: C. Aged cheese. This question addresses critical dietary restrictions for clients taking MAOIs. The keywords phenelzyme, Nardil, and MAOI immediately signal the need to avoid foods high in tyramine, which can cause a hypertensive crisis. Aged cheese is a classic example of a tyramine-rich food that must be strictly avoided. Ingesting tyramine with an MAOI can lead to a dangerous surge in blood pressure, severe headache, and potentially a stroke. For instance, other foods to avoid include processed meats, tap beer, and fermented products. Always emphasize the importance of avoiding tyramine-rich foods when taking MAOIs. Question 20. A nurse is caring for a client with a suspected ruptured appendix. Which assessment finding is most concerning and indicates a need for immediate surgical evaluation? A. Localized pain in the right lower quadrant. B. Nausea and vomiting. C. Rebound tenderness and guarding. D. A temperature of 100.2 degrees Fahrenheit 37.9 degrees Celsius. Answer: C. Rebound tenderness and guarding. This question tests the nurse's ability to identify critical signs of peritonitis, a serious complication of a ruptured appendix. The keyword ruptured appendix indicates a potential for widespread infection. Rebound tenderness, pain upon release of pressure, and guarding, involuntary muscle rigidity, are classic signs of peritonitis, which occurs when the appendix ruptures and infectious contents spill into the abdominal cavity. These findings require immediate surgical evaluation as peritonitis is a life-threatening condition. While localized pain, nausea, and a low-grade fever are common with appendicitis, rebound tenderness signifies a worsening condition. For example, peritonitis can quickly lead to sepsis and organ failure. Always prioritize signs of peritonitis in clients with suspected appendicitis. Question 21. A client with chronic kidney disease, CKD, on hemodialysis reports increasing itching. Which intervention is most appropriate for the nurse to recommend? A. Increase fluid intake to flush toxins. B. Apply emollients to the skin. C. Take a hot bath daily. D. Increase dietary protein. Answer: B. Apply emollients to the skin. This question addresses a common and uncomfortable symptom of chronic kidney disease and its management. The keyword itching, pruritus, is a frequent complaint in CKD clients, often due to the buildup of metabolic waste products, dry skin, and mineral imbalances. Applying emollients, such as moisturizing lotions or creams, helps to hydrate the skin, reduce dryness, and provide symptomatic relief from the itching. Increasing fluid intake is usually restricted in CKD. Hot baths can further dry the skin, and increasing protein is often regulated. For example, a client might use unscented moisturizing creams multiple times a day. Remember to offer practical comfort measures for chronic symptoms like pruritus in CKD. Question 22. A nurse is preparing a client for a colonoscopy. Which instruction is essential for the nurse to provide regarding bowel preparation? A. You will need to be NPO after midnight the day before the procedure. B. You should consume a clear liquid diet for 24 to 48 hours before the procedure. C. You can eat a light breakfast on the morning of the procedure. D. You will take a laxative tablet the evening before the procedure. Answer: B. You should consume a clear liquid diet for 24 to 48 hours before the procedure. This question tests knowledge of pre-procedure preparation for a colonoscopy, specifically regarding dietary restrictions for bowel cleansing. The keyword bowel preparation indicates the need for thorough cleansing of the colon. Consuming a clear liquid diet for 24 to 48 hours before the procedure, along with laxatives, is essential to ensure the colon is free of stool, allowing for clear visualization during the colonoscopy. Eating solid food, even a light breakfast, or only being NPO after midnight is insufficient for proper visualization. For example, clear liquids include broth, gelatin, and apple juice. Emphasize that a clear liquid diet is crucial for effective bowel preparation before a colonoscopy. Question 23. A client is receiving oxygen therapy via nasal cannula at 5 liters per minute. Which action by the nurse is most important to ensure client safety? A. Assess the client's skin for breakdown around the ears and nares. B. Ensure the humidifier is filled with sterile water. C. Check the oxygen flow rate every 4 hours. D. Instruct the client to breathe through their mouth for better oxygen absorption. Answer: A. Assess the client's skin for breakdown around the ears and nares. This question focuses on client safety during oxygen therapy, especially when delivered via nasal cannula. The keywords oxygen therapy via nasal cannula at 5 liters per minute highlight the potential for skin irritation. Pressure from the cannula tubing can cause skin breakdown, particularly behind the ears and around the nares, which are common pressure points. Regular assessment and protective measures, like padding, are crucial to prevent discomfort and potential skin injury. While humidification and checking flow rates are important, preventing skin integrity issues is a direct client safety concern that significantly impacts comfort and can lead to infection. For example, a nurse might place a soft dressing under the tubing behind the ears. Always prioritize preventing skin breakdown from medical devices, especially with continuous use. Question 24. A nurse is caring for a client with a CVA, stroke, who has left-sided hemiparesis. Which nursing intervention should be included in the client's plan of care? A. Place the call light on the client's left side. B. Position food on the client's left side during meals. C. Instruct the client to scan the environment to the left. D. Ambulate the client independently to promote strength. Answer: C. Instruct the client to scan the environment to the left. This question assesses appropriate nursing care for a client with hemiparesis following a stroke, specifically addressing potential neglect. Left-sided hemiparesis often means the client may neglect the left side of their body or their visual field to the left. Instructing the client to actively scan the environment to the left helps them acknowledge and compensate for this potential deficit, preventing injury and promoting safety. Placing the call light or food on the affected side would be unhelpful or unsafe, and independent ambulation would be inappropriate without proper assessment and assistance. For example, a client might bump into objects on their left side if they don't consciously look that way. Teach clients to actively scan their neglected side to prevent falls and other injuries. Question 25. A client with an exacerbation of ulcerative colitis reports severe abdominal pain and frequent bloody stools. The nurse observes the client's abdomen is rigid and distended. What is the nurse's priority action? A. Administer a prescribed antidiarrheal medication. B. Encourage oral fluid intake to prevent dehydration. C. Notify the healthcare provider immediately. D. Administer a prescribed opioid for pain relief. Answer: C. Notify the healthcare provider immediately. This question assesses the nurse's ability to recognize and prioritize a life-threatening complication in a client with ulcerative colitis. The keywords severe abdominal pain, rigid and distended abdomen, and ulcerative colitis exacerbation are critical signs of toxic megacolon or bowel perforation, both medical emergencies. A rigid, distended abdomen indicates peritonitis, requiring urgent surgical evaluation. Notifying the healthcare provider immediately is the priority because these findings indicate a rapidly deteriorating condition that could lead to sepsis and death. Antidiarrheals are often contraindicated, fluids are important but secondary, and pain medication does not address the underlying life-threatening issue. For example, delaying communication with the provider could have severe consequences for the client's outcome. Always prioritize immediate communication with the healthcare provider for sudden, severe changes in a client's abdominal assessment, especially in inflammatory bowel disease.